Hello and welcome to Dialysis Nurses Supporting Nurses. My name is Lindsey and we are going to talk about fistulas, specifically the process from start to finish, what that looks like. Best case scenario, your patient will come to the clinic with a fistula that's ready to use, but in all actuality that happens 10% of the time. So the other 90% of our patients are going to come to us in the dialysis clinic with a catheter. As a new dialysis nurse or a new dialysis tech or even a seasoned one, we can really appreciate how long it took us to become comfortable in the dialysis clinic. So you can really kind of share that with the patient when they come to dialysis, how overwhelming this new life change can be. So there is a lot to learn as a dialysis nurse, but also as a dialysis patient. And one of the things that should be the priority for us when we talk to our patients is about getting a permanent vascular access or a fistula or a graft. So here we go. Let's do the timeline. What will happen within the first 30 days that they start at the dialysis clinic is they'll have a care conference with the physician, the dietitian, the social worker, and the nurse. And during that care conference, we are going to talk to them about different dialysis modalities. So we will talk to them about peritoneal dialysis, home dialysis, and in-center dialysis, and then we'll also throw in transplant and kind of help start the process for them getting a transplant. So some of our patients will be like, oh, peritoneal dialysis, that sounds like it's right for me. I want to go that route. So from there, you'll talk to your PD nurses and you will send a referral to the vascular surgeon to get a peritoneal dialysis catheter. So those patients do not need a fistula because they are going to do a different type of dialysis. Our other patients, if they decide on in-center dialysis or home hemo, they will need permanent access or a fistula or a graft. So the patients are like, yep, I'm ready for a fistula, sign me up. We will send a referral to vascular surgery. So now here we are, we have day 1, and then let's say day 30, we have the care conference. And then from here, we have an appointment for vascular surgery. And that might be a couple weeks out. And they don't just go from here to there for surgery. They have to have their pre-op appointment. Part of that pre-op appointment will be a venous duplex ultrasound. That's essentially vein mapping, and that will give the surgeon a visualization of where they can put that fistula. From there, the surgeon will talk about risks and benefits, and best case scenario, they'll schedule a procedure for a couple weeks out. So now we're at like day 30, we're getting to day 60. So let's say, at day 60, day 70, they have their fistula placed, and now they come to the clinic. Yes, okay, thank you God, they got their fistula. What is next? We can't start cannulating yet. That fistula needs to mature and it needs to heal. If they have a graft, it will take 2 weeks, or even a fistula, whichever one it is, it takes 2 weeks for that incision to heal. If they have a graft, it's a little bit different. At the 2-week mark, generally, that is when we can start cannulating. With that in mind, it is important to follow your facility's protocol and talk with the provider and have a good relationship with the vascular surgeons as to how to manage these new fistulas that is best for the patient. So once we get to that 2-week mark, that is when, if they have a fistula, that they need to start doing fistula exercises. And this is so important. I cannot stress this enough. At our clinic, we give them a stress ball and we tell them to squeeze it kind of at waist height for 5 minutes a day. And this is going to increase blood flow to that fistula and help get those vessels nice and fat so that our needles have enough room to cannulate and provide good dialysis. Grafts we can start using at the 2-week mark, facility protocol. For fistulas, it'll take 6 weeks. So 2 weeks for the incision and the surgical incision to heal, and then another 4 weeks for the fistula to mature. And what that means is that fistula needs to get fat enough for our needles. When you are a dialysis nurse assessing your patient with a new fistula, it is important to always assess that new fistula and make sure that it is not developing an infection. I will also check for a thrill and bruit every time they're in, and also talk to their patient about how to check and make sure that they can feel the thrill. Because we don't want to go to like the 6-week mark and then we're like, oh, this fistula is not working. There's no thrill. I don't hear a bruit. How long has this been going on? So that is an important part of your assessment as a dialysis nurse, is checking for that thrill and bruit and seeing if it's, getting fatter. Like, we're getting to the 6-week mark? How's this looking? So now here I am. I'm complicating it again, but just like the dialysis patient, if you are new to dialysis, you're not going to know all of the answers right away. And that's all there is to it. seems simple, right? If you know the basics, when things start to complicate, it will all make sense. But I want to keep this video simple for you so you guys have a good base, have a good core of the process to get a fistula in our dialysis patients. Always educating, always asking questions, answering questions, and following up with our patients about permanent vascular access options. Thank you so much. I appreciate you.